Scanning through a fetus is always quite interesting. Amniotic fluid volume, maximum vertical pocket. Amniotic fluid accompanies the fetus in the amniotic sac. It functions as a cushion for fetus. Determine the amount of amniotic fluid around the baby. Check for opening or shortening of the cervix. Assess fetal growth. Monitor fetal development, check for congenital disabilities, hereditary conditions, or abnormalities. Placenta placement, spine, umbilical cord. A fetal ultrasound can also show if a woman is pregnant with multiple babies. The gestational age. The position of your placenta and the vessels in the umbilical cord will be examined. Problems with the placenta like placenta previa or placental abruption. Your baby is breech. This scan also checks your baby's heart rate and rhythm. You will most likely spot the fetus's head, nose, arms and legs. Unlike your first trimester ultrasound when the fetus looked like a tiny cluster of cells. A routine prenatal ultrasound can check for defects or other problems in the fetus. The following can be examined: abdomen and stomach, arms, legs, and other. This is the type of image pregnant mothers may see on the ultrasound screen or that the technician may print. What is a normal ultrasound examination of the fetal limbs? Visualization of the fetal limbs is an important part of the comprehensive examination of the fetus and is best accomplished at the end of the first trimester, early in the second trimester, or at the fetal anatomy examination at 18 to 20 weeks. Fetal movements refer to the muscular movements of the developing baby inside the mother's womb. These may be either reflex movements or elicited in response to noise or touch. All fetal movements are not alike. At first the mother may feel fluttering movements, which later turn to stronger kicks, and then she notices the baby squirming, rolling or wriggling. There are also hiccup movements. Thus fetal movements are classified as weak, strong, rolling. Before 9 weeks, all the limbs move together, as the nerves are still developing. The embryo arches its head and back. At 9 weeks yawns and stretches are visible on ultrasound. At 10 weeks from fertilization, you may see the limbs moving separately and startle movements. At 11 weeks the baby can open its mouth and suck its fingers. By 12 weeks, it is possible to watch the baby swallowing amniotic fluid. By 13 weeks, the baby vigorously moves arms and legs in kicks and jabs and can also respond to skin touch. At the 14th-20th week, a great event called quickening occurs. This is the first perception of fetal movement by the mother. Usually felt around 18 to 20 weeks in first pregnancies, it can be as early as 14 weeks in later pregnancies. The increased sensitivity of the more relaxed abdominal muscles. From the 20th 36 weeks, all types of fetal movements are felt: weak, strong and rolling movements. The baby moves all the joints and the spine, ensuring proper joint development. By 28 weeks, all babies show the startle reflex. Here the baby brings both arms and legs towards the chest. In the third trimester, the baby shows a bicycling movement of both feet, called stepping. This is important in helping to turn the baby upside down for a normal delivery. By this time, the movements are somewhat restricted by the confined space available to the now larger fetus. Fetal movements have their own time of day and sleep activity rhythm. The fetus is often most active between the hours of 9 a.m. and 2 p.m. and 7 p.m. to 4 a.m. In the last month or so of pregnancy, the baby kicks most during light sleep. The mother usually feels fetal movements best when she is lying down on the left side or sitting with her feet up and concentrating on the movements. Low volume of amniotic fluid hinders free movement of the fetus. Obesity, which leads to a thick abdominal wall. Anterior placenta, this is not valid after 28 weeks, which increases the thickness of the uterine wall at that point. Smoking. First pregnancy with tight abdominal muscles. Drugs such as alcohol, benzodiazepines, opioids including methadone, which sedate both mother and fetus. Whenever the mother feels that the baby's movements are reduced, investigation is in order to ensure that the baby is well. More than 10 kicks in 2 hours is usually deemed normal. A single episode of decreased fetal activity is not significant in 70% of mothers. When there is acute fetal distress, often there is a sudden flurry of fetal activity, mostly weak movements. However, with chronic fetal distress, it has been shown that there is a significant reduction or cessation of fetal movements for at least 12 hours before the fetal heart stops. This is called the movement's alarm signal and indicates impending fetal death. Changes in fetal heart rate follow the movement's alarm signal within 1 to 4 days if fetal death does not occur before that. Factors associated with decreased fetal movements: 1. Intrauterine growth retardation. 2. Fetal growth restriction.
The female reproductive organs include several key structures, such as the ovaries, uterus, vagina, and vulva. These organs are involved in fertility, conception, pregnancy, and childbirth. Thus, female anatomy includes the external genitals, or the vulva, and the internal reproductive organs, which include the ovaries and the uterus. One major difference between males and females is their reproductive organs. Anatomy specific to females generally relates to sexual function, reproduction, and hormone control. Males and females have physically different sexual anatomy, but all sex organs come from the same bundle of cells during fetal development. A baby's biological sex is determined at the moment the father's sperm meets the mother's egg. The female reproductive system is one of the most vital parts of the human reproductive process. Although a man is needed to reproduce, it is the woman who incubates the developing fetus and delivers the child into the world. Females are born with a large number of potential ova, female sex cells, also called egg cells. However, it isn't until after the onset of puberty, typically around age 12, that these cells are mature enough to sustain life. The cells ripen on a regular basis, but only one is released each month until a woman reaches menopause. Menopause commonly begins between the ages of 45 and 55. The reproductive organs also have a significant influence on other aspects of health. For example, the ovaries create hormones that impact bone density, cholesterol levels, heart health, and mood. More emphasis goes thus. The female reproductive system is a group of organs that work together to enable reproduction, pregnancy, and childbirth. It also produces female sex hormones, including estrogen and progesterone. The system consists of organs and tissues inside the body, and some that are visible outside the body. The internal organs include ovaries, fallopian tubes, uterus, cervix, vagina. Another organ, the clitoris, extends both inside and outside the body. The external area surrounding the vagina is the vulva. Not everyone who is assigned female at birth has all of these organs. Sometimes people are born without some parts or with a mixture of female and male characteristics. This is known as intersex. Some people also undergo procedures to remove some parts of the reproductive system. Some of these procedures take place for medical reasons, while others are the result of harmful cultural practices, such as female genital mutilation.
Spina bifida literally means split spine. A fault in the development of the spinal cord and surrounding bones, vertebrae, can leave a gap or split in the spine. The spinal cord does not form properly and may also be damaged. Diagnosis of spina bifida requires the systematic examination of each neural arch, from the cervical to the sacral region, both transversely and longitudinally. In the transverse scan, the normal neural arch appears as a closed circle with an intact skin covering, whereas in spina bifida the arch is U-shaped, and there is an associated bulging meningocele, thin-walled cyst, or melomeningocele. The extent of the defect and any associated kyphoscoliosis are best assessed in a digital scan. The site of open spina bifida are 1. Lumbosacral, 65%. 2. Sacral, 24%. 3. Thoracolumbar, 10%. 4. Sacral, 24%. 5. Thoracolumbar, 10%. 6. Cervical, 1%. Open spina bifida is associated with the Arnold-Chiari II malformation, with caudal displacement of the brain stem and obliteration of the cisterna magna. At 11 to 13 weeks gestation, in the mid-sagittal view of the head, the lower part of the brain between the sphenoid bone anteriorly and the occipital bone posteriorly can be divided into the brain stem in the front and a combination of the fourth ventricle and cisterna magna in the back. In most cases of open spina bifida, the diameter of the brain stem is increased, the distance between the brain stem and the occipital bone is decreased, and the ratio of the brain stem to occipital bone is greater than 1.0. In the second trimester, more than 95% of fetuses have frontal bone scalloping, lemon sign, and obliteration of the cisterna magna, with either an absent cerebellum or abnormal anterior curvature of the cerebellar hemispheres, banana sign. A variable degree of ventricular enlargement is present in virtually all cases of open spina bifida at birth, but in only about 70% of cases in the mid-trimester. Supplementation of the maternal diet with folate, 5 mg day, for 3 months before and 2 months after conception, reduces the risk of recurrence by about 75%. Thanks for watching. Please subscribe for more. Hello everyone. This is Ultrasound Made Easy. Now we will be looking at baby girl sex at 20 weeks of pregnancy. As technology advances, seeing the vulva, clitoris, and labia are taken to indicate a female fetus. Seeing the internal pelvic structure of the fetus, including the uterus and ovary, is also used to help identify the fetal gender. There is a substantial chance of getting a false negative diagnosis if the ultrasound imaging for fetal gender identification has been performed in the first trimester of pregnancy. However, research suggests a better sensitivity of ultrasound imaging for fetal gender identification performed in the second trimester of pregnancy. The sensitivity depends on the operator, machine, and habitus involved, and it increases with the radiologist's experience and if ultrasound imaging is performed using the high-resolution machine. Rather than the dome sign, seeing what looks like 3 light layered lines, also called the hamburger sign, in the genital area indicates a girl. Those lines are the labia majora, the clitoris, and the labia minora. You will see that the labia lips look similar to a hamburger bun, while the clitoris resembles a hamburger patty. Thanks for watching. Please subscribe, like and share.
Ovarian cysts are sacs, usually filled with fluid, in an ovary or on its surface. Females have 2 ovaries. 1 ovary is located on each side of the uterus. Each ovary is about the size and shape of an almond. Eggs develop and mature in the ovaries. Eggs are released in monthly cycles during the childbearing years. Ovarian cysts are common. Most of the time, you have little or no discomfort, and the cysts are harmless. Most cysts go away without treatment within a few months. But sometimes ovarian cysts can become twisted or burst open, rupture. This can cause serious symptoms. To protect your health, get regular pelvic exams and know the symptoms that can signal what might be a serious problem. Most ovarian cysts cause no symptoms and go away on their own. But a large ovarian cyst can cause pelvic pain that may come and go. You may feel a dull ache or a sharp pain in the area below your belly button toward one side. Fullness, pressure or heaviness in your belly, abdomen. Get immediate medical help if you have sudden, severe abdominal or pelvic pain. Pain with fever or vomiting. Signs of shock. These include cold, clammy skin, rapid breathing, and lightheadedness or weakness. Most ovarian cysts form as a result of your menstrual cycle. These are called functional cysts. Other types of cysts are much less common. Functional cysts: your ovaries grow small cysts called follicles each month. Follicles produce the hormones estrogen and progesterone and break open to release an egg when you ovulate. A monthly follicle that keeps growing is known as a functional cyst. There are two types of functional cysts: follicular cyst. About halfway through your menstrual cycle, an egg bursts out of its follicle. The egg then travels down a fallopian tube. A follicular cyst begins when the follicle doesn't rupture. It doesn't release its egg and continues to grow. Corpus luteum cyst. After a follicle releases its egg, it shrinks and begins producing estrogen and progesterone. These hormones are needed for conception. The follicle is now called the corpus luteum. Sometimes, the opening where the egg came from gets blocked. Fluid builds up inside the corpus luteum, causing a cyst. Functional cysts are usually harmless. They rarely cause pain and often disappear on their own within 2 to 3 menstrual cycles. There are other types of cysts that are not related to menstrual cycles. Dermoid cyst. Also called a teratoma, this cyst forms from reproductive cells that make eggs in the ovary, germ cells. The cyst can contain tissue, such as hair, skin or teeth. This type of cyst is rarely cancer. Ovarian teratomas are a type of tumor or mass that develop on the ovaries. The majority are non-cancerous and require surgery to remove them. Teratomas are a type of tumor or mass of cells that develop from one or more layers of germ cells, which are the cells that help form the male and female reproductive systems. The majority of teratomas that occur on the ovaries are benign, with only a few being cancerous. Anytime a woman is having unusual pain in her pelvis, she should check in with a healthcare professional. The doctor will be able to perform a pelvic exam or order additional diagnostic tests to help figure out the source of the pain. Complications associated with ovarian pain depend on what is causing the discomfort. Thanks for watching. Please subscribe, like and press on notification bell.
Wow. Multiple pregnancy. Dichorionic, deamniotic. Baby boy for sure. An active baby. With fingers towards mouth. Intending to suck a finger. Thanks for watching. Anencephaly. Anencephaly is the absence of a large part of the brain and the skull. There are three types of anencephaly. 1. Moronencephaly, where there is rudimentary brain tissue and partial formation of the cranium. 2. Halonencephaly, the most common type, in which the brain is completely absent. And 3. Craniorachis. Craniorachis is a very serious neural tube defect, characterized by the combination of anencephaly, absence of the brain and cranial vault, without skin covering, with a contiguous bony defect of the spine, also without meninges covering the neural tissue rachis. Causes. Anencephaly is one of the most common neural tube defects. Neural tube defects are birth defects that affect the tissue that becomes the spinal cord and brain. Anencephaly occurs early in the development of an unborn baby. It results when the upper part of the neural tube fails to close. The exact cause is not known. Possible causes include 1. Environmental toxins. 2. Low intake of folic acid by the mother during pregnancy. Some babies have anencephaly because of a change in their genes or chromosomes. Anencephaly might also be caused by a combination of genes and other factors, such as the things the mother comes in contact with in the environment, or what the mother eats or drinks, or certain medicines she uses during pregnancy. The exact number of cases of anencephaly is unknown. Many of these pregnancies result in miscarriage. Having one infant with this condition increases the risk of having another child with neural tube defects. Symptoms of anencephaly are 1. Absence of the skull. 2. Absence of parts of the brain. 3. Facial feature abnormalities. 4. Severe developmental delay. 5. Heart defects may be present in 1 out of 5 cases. An ultrasound during pregnancy is done to confirm the diagnosis. The ultrasound may reveal too much fluid in the uterus. This condition is called polyhydramnios. On ultrasound examination of the fetus, the calvaria and brain parenchyma are not visualized. Biparietal diameter and head circumference cannot be measured. A coronal section through the fetal face shows frog-like bulging of eyes and absent frontal bones. An anencephalic fetus has a triangular-shaped face and lacks the anterior region of the skull, both of which can be seen on the sonogram. Fetuses with anencephaly are correctly identified at 12 to 13 weeks gestation. Anencephaly occurs in absence of the cranial vault. Ultrasound findings can be normal until onset of ossification has definitely failed. A first trimester scan at 12 to 13 weeks allows reliable diagnosis and active management of anencephaly. Summarily, how do you identify anencephaly? What are the symptoms of anencephaly? 1. Absence of bony covering over the back of the head. 2. Missing bones around the front and sides of the head. 3. Folding of the ears. 4. Cleft palate, a condition in which the roof of the child's mouth doesn't completely close, leaving an opening that can extend into the nasal cavity. The mother may also have these tests during pregnancy. 1. Amniocentesis, to look for increased levels of alpha-fetoprotein. Alpha-fetoprotein level, increased levels suggest a neural tube defect. 2. Urine estriol level. 3. A pre-pregnancy serum folic acid test may also be done. Prevention. There is good evidence that folic acid can help reduce the risk for certain birth defects, including anencephaly. Women who are pregnant or planning to become pregnant should take a multivitamin with folic acid every day. Many foods are now fortified with folic acid to help prevent these kinds of birth defects. Getting enough folic acid can cut the chances of neural tube defects in half. Thanks for watching. Please subscribe, like, comment and share. Ask questions.
Cirrhosis is occasionally known as end-stage liver disease. It comes after the different levels of harm, which can consist of irritation, hepatitis, fatty deposits, steatosis, and accelerated stiffness and mild scarring of your liver, fibrosis. Many humans with cirrhosis can sense pretty properly and stay for many years, besides wanting a liver transplant. This is due to the fact the liver can characteristic notably function nicely, even when it is pretty severely damaged. Cirrhosis is categorized as compensated or decompensated. Compensated cirrhosis is the place the liver is coping with the injury and retaining its vital functions. In decompensated cirrhosis, the liver is no longer capable to function all its features adequately. People with decompensated liver disorder or cirrhosis regularly have serious signs and symptoms and issues such as portal hypertension, bleeding varices, ascites, and hepatic encephalopathy. There are additionally structures for grading cirrhosis in accordance to its severity. One of these is the Child-Pugh score, which makes use of signs together with encephalopathy and ascites collectively with blood. Take a look at outcomes for bilirubin, albumin, and clotting to grade cirrhosis from A, relatively mild, to C, severe. There are different structures which includes MELD, model of end-stage liver disease, which are used to assist figure out which sufferers most urgently want liver transplants. It makes use of blood. Take a look at consequences for bilirubin, creatinine, and clotting, INR. Do you have lumps on your neck or behind your ear? This is what it means, and this is what you must do. Lumps can be pretty bothersome, so all and sundry who receives a lump in their physique is afraid of its fitness value as nicely as its appearance. It's now not common, however they are common. Small lumps on the neck or at the back of the ears are most common. These lumps are a kind of cyst referred to as an epidermal cyst, and they are specific from a sebaceous cyst. A sebaceous cyst is an end result of the mammary glands. There is no want to deal with an epidermal cyst, however many human beings favor to get rid of them due to the fact it can reason contamination in some instances and is unsightly. To get rid of an epidermal cyst, there is no want for clinical techniques due to the fact there are herbal redress that we will current to you today. Here is a listing of remedies that will assist you get rid of the lump on the neck or in the back of the ear. 1. Apple cider vinegar. Apple cider vinegar is very advantageous due to the fact of the acetic acid it contains. It eliminates the contamination and protects you from bacteria. Take some apple cider vinegar and observe it on the lump. Put a bandage or plaster to hold it. Do this each and every day for a week, till the cyst turns into a difficult layer of skin. Remove the layer and make positive the cyst can be drained. Then put some apple cider vinegar on the place for some other week, and your pores and skin will be easy again.
Ultrasonography is a commonly used tool to evaluate the status of pregnancy. Complications arising from pregnancy are frequently encountered complaints in emergency departments and prenatal clinics. Though home pregnancy tests are increasingly popular, some women may discover they are pregnant for the first time in the outpatient setting. A true gestational sac can be distinguished from a pseudogestational sac by noting these points. 1. Its normal eccentric location. It is embedded in the endometrium rather than centrally within the uterine cavity. 2. Presence of the double decidual sign, most helpful at 4 to 6 weeks. 3. Presence of a yolk sac. Seen at approximately 6 weeks, unequivocal evidence of a gestational sac. However, caution should be exercised with a diagnosis of a pseudogestational sac. In a woman with a positive beta-HCG, any intrauterine sac-like fluid collection seen on ultrasound is highly likely to be a gestational sac. An irregular gestational sac, lack of a smooth contour and/or presence of a distorted sac shape is highly suggestive of an abnormal intrauterine pregnancy. First trimester ultrasounds are not a requirement for all pregnancies to confirm viability. However, if any high-risk features, such as advanced maternal age, twin pregnancy, and/or clinical concerns are present, such as irregular menses, vaginal bleeding, more than one ultrasound may be performed at the clinician's discretion. With the first ideally in the late first trimester between 10 and 13 weeks. However, ultrasound exams before 10 weeks are common and can still be used as accurate assessments for most necessary clinical determinations. It may be utilized as a part of the standard evaluation during pregnancy or to elucidate other concerning signs and symptoms. Missed abortion as a pregnancy complication. Missed abortion is when a pregnancy stops developing, where the embryo-fetus embryonic tissue or empty gestation sac remains in the uterus and the cervical os is closed. Symptoms may include pain, bleeding or no symptoms at all. If an ultrasound is done, the scan may show an embryo or fetus without cardiac activity or what appears to be an early developing pregnancy, with only a fluid-filled sac visible within the uterus. Medical, surgical, vacuum aspiration, and expectant management are all options for management of missed abortion. The causes of missed abortion are not fully known. About 50% of miscarriages happen because the embryo has the wrong number of chromosomes. Sometimes, miscarriage may be caused by a uterine problem like scarring. You may be at higher risk for missed miscarriage if you have an endocrine or an autoimmune disorder or are a heavy smoker. Physical trauma can cause a missed miscarriage as well. Ultrasound diagnosis of miscarriage should only be considered when either a mean gestation sac diameter is greater than or equals to 25 mm, with no obvious yolk sac, or a fetal pole with a crown rump length of greater than or equals to 7 mm, without evidence of fetal cardiac activity. Transvaginal ultrasound is the mainstay in the diagnosis of miscarriage. Once the diagnosis of miscarriage is made based on the above ultrasound criteria, the patient can then be offered different types of management depending on their clinical status and patient's choice. Expectant management is possible, with a wait-and-watch approach offered after careful counseling to women who have met the inclusion criteria. Was quite easy, right? Learning is fun. Subscribe for The Ramsay theory is a strategy for using the location of the placenta during early pregnancy ultrasounds to predict the sex of a baby. Some people claim on online message boards that the method is as much as 97% reliable. Proponents refer to a study that involved a large number of ultrasounds. However, that study has not undergone peer review, and Dr. Sam Ramsay Ismail, who put his name to the theory, did not publish his research in a peer-reviewed journal. No major medical organization recognizes the theory as valid, and a 2010 study trusted source in a peer-reviewed journal disputes the notion that placental location correlates with sex. Sex differentiation, the process by which embryos begin developing male or female structures, begins early in development, usually about 6 weeks into the pregnancy. Proponents of the Ramsay theory argue that this means that it is theoretically possible to detect early indicators of sex well before a mid-pregnancy ultrasound might reveal this information. The theory began with an ultrasound study of 5,376 pregnant people who had ultrasounds at either 6 or 18-22 weeks of pregnancy. However, just 1,200 participants had both ultrasound scans. Researchers were able to see the external genitalia in 99% of male fetuses and 98% of female fetuses during the second trimester ultrasound. They found that 97.2% of male fetuses had a placenta on the right side of the uterus during the early ultrasound at 6 weeks, while 97.5% of fetuses had a placenta on the left side of the uterus. Drawing on this data, they concluded that a placenta on the right side usually indicates a male fetus, while a placenta on the left side is a sign that a fetus is female. This distinction is the basis of the Ramsey theory. Many message boards feature stories of people who used the Ramsey method to predict the sex of their baby correctly. Any sex prediction method has a 50% chance of being right, though, so anecdotal evidence is not reliable. Thanks for watching. Please subscribe, like, share. Thank you. Obstetric ultrasound. Obstetric ultrasound uses sound waves to produce pictures of a baby within a pregnant woman, as well as the mother's uterus and ovaries. It does not use ionizing radiation, has no known harmful effects, and is the preferred method for monitoring pregnant women and their unborn babies. The procedure is a standard part of prenatal care in many countries, as it can provide a variety of information about the health of the mother, the timing and progress of the pregnancy, and the health and development of the embryo or fetus. Obstetrical ultrasound is a useful clinical test to establish the presence of a living embryo fetus, estimate the age of the pregnancy, diagnose congenital abnormalities of the fetus, evaluate the position of the fetus, evaluate the position of the placenta, determine if there are multiple pregnancies, determine the amount of amniotic fluid around the baby, check for opening or shortening of the cervix, assess fetal growth, assess fetal well-being. Performing an ultrasound at this early stage of pregnancy can more accurately confirm the timing of the pregnancy and can also assess for multiple fetuses and major congenital abnormalities at an earlier stage. Research shows that routine obstetric ultrasound before 24 weeks gestational age can significantly reduce the risk of failing to recognize multiple gestations and can improve pregnancy dating to reduce the risk of labor induction for postdates pregnancy. There is no difference, however, in perinatal death or poor outcomes for infants. You should wear a loose-fitting two-piece outfit for the examination. Only the lower abdominal area needs to be exposed during this procedure. The sonographer may elect to examine an early pregnancy by means of transvaginal ultrasound in order to see the pregnancy more closely or to assess the cervix. The sonographer will position you on the exam bed. They will apply a water-based gel to the area of the body under examination. The gel will help the transducer make secure contact with the body. It also eliminates air pockets between the transducer and the skin that can block the sound waves from passing into your body. The sonographer places the transducer on the body and moves it back and forth over the area of interest until it captures the desired images. There is usually no discomfort from pressure as they press the transducer against the area being examined. However, if the area is tender, you may feel pressure or minor pain from the transducer. Once the imaging is complete, the technologist will wipe off the clear ultrasound gel from your skin. Any portions that remain will dry quickly. The ultrasound gel does not usually stain or discolor clothing. Most ultrasound exams are painless, fast, and easily tolerated. However, at times during an obstetrical ultrasound, the sonographer may have to press more firmly to get closer to the embryo or fetus to better visualize the structures. Any discomfort is usually minimal and temporary. If the sonographer performs a Doppler ultrasound exam, you may hear pulse-like sounds that change in pitch as they monitor and measure the blood flow. With transvaginal scanning, There may be minimal discomfort as the transducer is inserted into the vagina. This ultrasound examination is usually completed within 30 minutes. When the exam is complete, the technologist may ask you to dress and wait while they review the ultrasound images. After an ultrasound exam, you should be able to resume your normal activities immediately. What are the benefits versus risks? Benefits. Most ultrasound scanning is non-invasive, no needles or injections. Occasionally, an ultrasound exam may be temporarily uncomfortable, but it should not be painful. Ultrasound is widely available, easy to use, and less expensive than most other imaging methods. Ultrasound imaging is extremely safe and does not use radiation. Ultrasound scanning gives a clear picture of soft tissues that do not show up well on X-ray images. Ultrasound is the preferred imaging modality for the diagnosis and monitoring of pregnant women and their unborn babies. Ultrasound has been used to evaluate pregnancy for nearly 4 decades, and there has been no evidence of harm to the patient, embryo or fetus. Nevertheless, ultrasound should be performed only when medically indicated. Ultrasound allows the doctor to see inside the uterus and provides much information about the pregnancy. Risks. Standard diagnostic ultrasound has no known harmful effects on humans. What are the limitations of obstetrical ultrasound imaging? Obstetric ultrasound cannot identify all fetal abnormalities. Consequently, when there are clinical or laboratory suspicions for a possible abnormality, a pregnant woman may have to undergo non-radiologic testing to determine the health of the fetus, or she may be referred by her primary care provider to a perinatal assessment of gestational age with sonography is a critical element of evaluating a pregnant woman in any healthcare setting. Providing care for pregnant women should be comfortable using basic sonographic techniques to determine the gestational age of a fetus, which helps guide the care of both the fetus and the pregnant woman. Sonography can be used at different levels of gestational development to determine the age of the growing fetus, care of the woman and fetus, and may affect dates that determine the viability of the fetus, expected delivery date, and appropriate growth rate. The most accurate method to determine gestational age is during weeks 8 through 12, when the crown rump length can be determined, and the fetus is in its greatest and most consistent rate of growth. Earlier and later developmental time periods may also remain useful in the appropriate clinical context to confirm dates. Determining gestational age is indicated in any pregnant female with an unknown date of the last menstrual cycle, to confirm estimated dates, or any patient with unknown dates of gestational age. There are 3 identifiable structures on ultrasound that appear sequentially during the first trimester: the gestational sac, the yolk sac, and the embryonic pole. The gestational sac appears approximately 30 days following the beginning of the last menstrual cycle. It appears as a small, hypoechoic structure near the fundus of the uterus. The gestational sac represents the chorionic sac and grows approximately 1 mm per day after it becomes visible. Appearing within the gestational sac, the yolk sac is a small, circular, hyperechoic ring that appears at about day 35, or between weeks 5 and 6, counted from the beginning of the last menstrual cycle. The yolk sac also grows at about 1 mm per day until about 9 weeks, when it begins to regress. The yolk sac is less useful in determining gestational age. The embryonic pole first appears as a small linear structure congruent with the yolk sac, giving the appearance of a signet ring. This embryonic pole is the first structure that can be measured to obtain the crown rump length and gives an accurate date to the gestational age. The embryonic pole will develop a cephalic and caudal portion that first appears wrapped or bent tightly to the embryo. As these begin to unfold and the limbs appear, the first true crown rump length measurements can be obtained. The differentiation between a fetus and embryo occurs at about 9 weeks when organogenesis has completed, and the developing fetus focuses on maturation and further development of existing structures. The gestational sac is a fluid-filled structure surrounding an embryo during the first few weeks of embryonic development. It is the first structure seen in pregnancy by ultrasound as early as 4.5 to 5 weeks of gestational age and is 97.6% specific for the diagnosis of intrauterine pregnancy, meaning it is the only available structure that can be used to determine if an intrauterine pregnancy exists until the embryo can be identified. Its diameter is about 2 mm and increases in size to measure 5-6 mm at 5 weeks. The mean gestational sac diameter then increases by approximately 1 mm per day throughout the first trimester. The gestational sac, being a large cavity of fluid surrounding the embryo during early embryogenesis, consists of the extraembryonic coelom, also called the chorionic cavity. The gestational sac is normally contained within the uterus. It provides an embryo with nourishment, food. It helps circulate gases between mother and the embryo. The yolk sac also produces cells that turn into important structures, such as the umbilical cord, blood cells and reproductive organs. An abnormally shaped gestational sac or yolk sac should raise concern for a failing pregnancy. The gestational sac should normally be round or oval. An irregular gestational sac with angulations or teardrop shape is associated with a poor prognosis. The advent of ultrasound has allowed a more direct means of assessing fetal structures and development. Measurements of a wide variety of parameters have been devised to establish gestational age. Ultrasound assessment of gestational age is feasible in a majority of pregnancies and may be used to establish gestational age with greater accuracy than physical examination. The gestational sac is an echo-free space containing the fluid, embryo, and extraembryonic structures. The sac is measured inside the hyperechoic rim, including only the echo-free space. The gestational sac is imaged first in the longitudinal plane, obtaining long axis and anteroposterior measurements perpendicular to each other. Then, in the transverse plane at the level of the anteroposterior measurement, the width measurement is obtained. The 3 measurements are averaged to obtain the gestational sac mean diameter. In other words, the gestational age of the embryo is determined by measuring the mean diameter of the sac, as measured from inside wall to inside wall of the sac. If the gestational sac is not completely round, then it may be measured using 3 orthogonal distances from the inside of the sac, using sagittal and transverse views. The mean sac diameter is then either compared to a table of values, input into a regression model, or input into the ultrasound machine, determining the estimated age through preset calculators on an obstetric setting. Thanks for watching. Learning is fun. Subscribe for more.
Ultrasound is an imaging test that uses sound waves to create pictures of organs, tissues, and other structures inside the body. Unlike X-rays, ultrasounds don't use any radiation. Ultrasound can also show parts of the body in motion, such as a heart beating or blood flowing through blood vessels. There are 2 main categories of ultrasounds: pregnancy ultrasound and diagnostic ultrasound. Pregnancy ultrasound is used to look at an unborn baby. The test can provide information about a baby's growth, development, and overall health. Diagnostic ultrasound is used to view and provide information about other internal parts of the body. These include the heart, blood vessels, liver, bladder, kidneys, and female reproductive organs. To begin our interesting study, discussions on basic ultrasound instrumentation have historically focused on proper handling of the transducer and adjustment of controls for image optimization. Any ultrasound system has three basic components: a transducer, or probe, the processing unit, including the controls, and the display. Ultrasound transducer is a device that produces sound waves that bounce off body tissues and make echoes. The transducer also receives the echoes and sends them to a computer that uses them to create an image called sonogram. Positioning the probe during an ultrasound is very necessary. Every probe has an orientation notch that is a small marker or grooved line on one side of the probe. Begin by holding the probe with the thumb side of your hand near the orientation notch or groove. There are three standard described scan planes: body planes, coronal, sagittal transverse. The beginner is generally advised to stay in these simple planes so as to be able to reliably obtain recognizable images repeatedly. This is what makes focused scanning feasible. With experience, changes in the inclination of planes helps to obtain improved images. When using the longitudinal orientation, hold the probe so that the orientation notch is pointing towards the patient's head. When using the transverse orientation, the notch should be towards the patient's right side. This will orient your screen to the corresponding plane. Thanks for watching. Share and subscribe for more.
Have you subscribed? Please kindly press subscribe button. A good knowledge of ultrasound will begin with the least unexpected aspects, as in receiving a patient. Greet the patient, introduce yourself, make the patient feel relaxed, ask opening questions. Direct the patient to an ultrasound examination bed, set the gel, the liquid used to fill the gap between the skin and the ultrasound transducer, so that there is no intervening air to interfere with ultrasound transmission. Now, we have learned on the handling, inclination techniques of a transducer. Have you ever looked at an ultrasound image and wondered what are you looking at? Ever wonder which end is up? When others are discussing Buller-Heifer, ovarian diagnosis, or metritis treatment, are you still looking to decide what it is? Well, if you feel left in the dark when it comes to ultrasound images, let's start back at the basics. Ultrasound is a non-invasive, immediate tool used to image tissue. It will not penetrate bone, like an X-ray. So the first step to help you read the ultrasound image is to be familiar with the anatomy that you are imaging. Various body tissues conduct sound differently. Some tissues absorb sound waves while others reflect them. The density of the tissue dictates the speed at which the echoes return. If you remember that fluid is always black and tissue is gray. The denser the tissue is, the brighter white it will appear in ultrasound, the brightest white being bone. After learning that fluids appear black, tissue appear gray, and bone appear white on ultrasound, now we need to understand the terms which are generally used. Anechoic. This term means without echoes. These areas appear black on ultrasound because they do not send back any sound waves. Anechoic masses are often fluid-filled. Hypoechoic. This term means not many echoes. These areas appear dark gray because they don't send back a lot of sound waves. Solid masses of dense tissue are hypoechoic. Hyperechoic. This term means lots of echoes. These areas bounce back many sound waves. They appear as light gray on the ultrasound. They may contain air, fat, or fluid. Thanks for watching. Subscribe and share. Gynecological sonography is an important diagnostic modality commonly used to evaluate emergent conditions and many common gynecological disorders. Knowledge of the anatomy and physiology of the female pelvis is an important prerequisite in obtaining and interpreting gynecological sonographic images. The transducer should be selected to operate at the highest clinically appropriate frequency that will allow adequate visualization of deep pelvic structures. For transabdominal evaluation, a 3.5 MHz or higher transducer is employed. Curved linear array, as well as sector transducers with a smaller footprint are often employed. For transabdominal evaluation, the bladder should be adequately distended to displace bowels superiorly out of the true pelvis and provide an acoustic window to visualize the uterus and adnexa. The uterus is an extraperitoneal hollow, thick-walled, muscular organ of the female reproductive tract that lies in the lesser pelvis. It is inverted pear shape. It measures about 7.5 centimeters in length, 5 centimeters wide at its upper part, and nearly 2.5 centimeters in thickness in adults. It weighs approximately 30 to 40 grams. The uterus is a hollow organ in which the myometrium is firmly adherent to a thin internal layer of endometrium. Externally, the uterus is embedded between the two layers of the broad ligament. Anatomically, the uterus lies between the bladder anteriorly and the rectosigmoid colon posteriorly. The uterus is divided into two major parts, the body and cervix. The most superior aspect of the uterus is referred to as the fundus, and the entrance of the fallopian tubes into the uterus are referred to as the cornua. About midway between the apex and base is a slight constriction known as the isthmus. The portion above the isthmus is termed the body, and that below the cervix. The part of the body which lies above a plane passing through the points of the entrance of the uterine tubes is known as the fundus. The body gradually narrows from the fundus to the isthmus. Anterior to the origin of the fallopian tubes are the round ligaments, one on each side, which extend anterolaterally, coursing through the inguinal canals and inserting onto the fascia of the labia majora. The uterus has a dual blood supply. The majority of blood supply is from the uterine arteries arising from the internal iliac arteries, and a minor blood supply is from the ovarian arteries. The uterus is physiologically most often anteroverted and anteroflexed, but may also be retroflexed or retroverted. The cervix of the uterus is fixed in the midline, but the body of the uterus can be mobile and may change with varying degrees of bladder and rectal distension. Descriptions of flexion refer to the relationship of the body of the uterus to the cervix. Usually the angle is about 270 degrees, whereas version refers to the cervical relationship to the vagina. The vagina, uterus, and the urinary bladder are used as reference points for identification of the remaining normal and abnormal pelvic structures. The uterine size, shape, and orientation should be identified and documented in sagittal and transverse axial planes. The endometrium, myometrium, and cervix should be carefully evaluated and their appearance documented. The uterine length is measured in long axis from the fundus to the cervix, and the anteroposterior dimension is measured on the same image perpendicular to the length. The width is to be measured on a separate image on either a transaxial or coronal plane of section. If the volume of the uterine corpus is assessed, the cervical component should be excluded. Follow our next study on the ovaries, adnexa, and fallopian tubes. Then we continue with identification of pathologies. Thanks for watching. Subscribe and press notification.
Getting a good knowledge of the ideal anatomy will facilitate the identification of structures in ultrasound. We continue with the second segment of this lectures. Ovaries. Most females have two ovaries, one on each side of the uterus. They are about the shape and size of an almond and have two key functions: producing hormones and releasing eggs. At birth, two ovaries contain approximately 700,000 oocytes, which are immature eggs. When a person reaches puberty, these eggs begin to develop and mature inside the ovary follicles. Around once each month, the ovaries release a mature egg. This process is known as ovulation, and it is part of the menstrual cycle. It is also what makes pregnancy possible. The hormones the ovaries produce regulate the menstrual cycle. They also influence the development of female sex traits, facilitate pregnancy, childbirth, and breast milk production, contribute to the health of the bones, heart, liver, brain, and other tissues, influence mood, sleep, and sex drive. Fallopian tubes. The fallopian tubes are passageways that carry eggs toward the uterus. They consist of several parts: the infundibulum, which is a funnel-shaped opening near the ovaries; the fimbriae, which are finger-like projections surrounding the opening; cilia, which are hair-like structures inside the fallopian tubes. When an ovary releases an egg, fluid in the fimbriae propel it toward the fallopian tube opening. Once inside, the cilia move the egg toward the uterus. This journey takes about 7 days. During this time, it is possible for sperm to fertilize the egg if a person has sexual intercourse. Most fertilization happens in the fallopian tubes. The uterus is an organ that is about the shape and size of a pear. It is also known as the womb. It consists of muscular walls and a lining, endometrium, that grows and diminishes with each menstrual cycle. After ovulation, the endometrium gets thicker in preparation for a fertilized egg. If not fertilized, the egg dies, and the lining of the womb sheds after around 2 weeks. The lining breaks down into blood, which then leaves the body through the vagina. This is menstruation, also called a period. If an egg does become fertilized by sperm, it will implant into the lining of the uterus and begin to develop. The cells divide and grow, becoming an embryo. Over time, it grows into a fetus, which receives oxygen and nutrients from the placenta via the umbilical cord. When it is time for the fetus to be born, the uterus begins strong muscle contractions that dilate the cervix and push the fetus out. The cervix is a cylinder-shaped neck of tissue that connects the vagina and uterus. Located at the lowermost portion of the uterus, the cervix is composed primarily of fibromuscular tissue. There are 2 main portions of the cervix. The part of the cervix that can be seen from inside the vagina during a gynecologic examination is known as the ectocervix. An opening in the center of the ectocervix, known as the external os, opens to allow passage between the uterus and vagina. The endocervix, or endocervical canal, is a tunnel through the cervix, from the external os into the uterus. The overlapping border between the endocervix and ectocervix is called the transformation zone. The cervix produces cervical mucus that changes in consistency during the menstrual cycle to prevent or promote pregnancy. During childbirth, the cervix dilates widely to allow the baby to pass through. During menstruation, the cervix opens a small amount to permit passage of menstrual flow. The vagina is an elastic, muscular canal with a soft, flexible lining that provides lubrication and sensation. The vagina connects the uterus to the outside world. The vulva and labia form the entrance, and the cervix of the uterus protrudes into the vagina, forming the interior end. The vagina receives the penis during sexual intercourse, and also serves as a conduit for menstrual flow from the uterus. During childbirth, the baby passes through the vagina, birth canal. The hymen is a thin membrane of tissue that surrounds and narrows the vaginal opening. It may be torn or ruptured by sexual activity or by exercise. Thanks for watching.
Uses and advantages of ultrasound. Generally, ultrasound imaging uses sound waves to produce pictures of the inside of the body. It helps diagnose the causes of pain, swelling and infection in the body's internal organs, and to examine an unborn child, fetus, in pregnant women. In infants, doctors commonly use ultrasound to evaluate the brain, hips, and spine. It also helps guide biopsies, diagnose heart conditions, and assess damage after a heart attack. Ultrasound is safe, non-invasive, and does not use radiation. This procedure requires little to no special preparation. Your doctor will tell you how to prepare, including whether you should not eat or drink beforehand. Leave jewelry at home and wear loose, comfortable clothing. You may need to change into a gown. Ultrasound exams can help diagnose a variety of conditions and assess organ damage following illness. Doctors use ultrasound to evaluate pain, swelling, infection. Ultrasound is a useful way of examining many of the body's internal organs, including but not limited to the heart and blood vessels, including the abdominal aorta and its major branches, liver, gallbladder, spleen, pancreas, kidneys, bladder, uterus, ovaries, and unborn child, feet, eyes, thyroid and parathyroid glands, scrotum, testicles, brain in infants, hips in infants, spine in infants. Ultrasound is also used to guide procedures such as needle biopsies, in which needles remove cells from an abnormal area for laboratory testing. Image the breasts and guide biopsy of breast cancer. Diagnose a variety of heart conditions, including valve problems and congestive heart failure, and to assess damage after a heart attack. Ultrasound of the heart is commonly called an echocardiogram, or echo for short. Doppler ultrasound helps the doctor to see and evaluate blockages to blood flow, such as clots, narrowing of vessels, tumors and congenital vascular malformations. Reduced or absent blood flow to various organs, such as the testes or ovary. Increased blood flow, which may be a sign of infection. Doctors use ultrasound to detect changes in the appearance of organs, tissues, and vessels, and to detect abnormal masses, such as tumor. What are the advantages of ultrasound? Most ultrasound scanning is non-invasive, no needles or injections. Ultrasound is widely available, easy to use, and less expensive than most other imaging methods. Ultrasound imaging is extremely safe and does not use radiation. Ultrasound scanning gives a clear picture of soft tissues that do not show up well on X-ray images. Ultrasound is the preferred imaging modality for the diagnosis and monitoring of pregnant women and their unborn babies. Ultrasound provides real-time imaging. This makes it a good tool for guiding minimally invasive procedures, such as needle biopsies and fluid aspiration. Standard diagnostic ultrasound has no known harmful effects on humans. Thanks for watching. God bless us all. Please kindly subscribe for more. Subscribe.